Can everyone hear me okay? Maybe someone chat. Yes, great. Okay, we are ready. So welcome everyone to the webinar, Nature and Health in Communities, a review of best available science. My name is Holly Campbell and I'll be the host for the webinar today. I'm an Extension Associate with Southern Regional Extension Forestry, working in the program or focus areas of urban forestry and wildland fire. As part of the Cooperative Extension System, our office develops educational products and resources to support regional forestry and natural resource programs in the southeastern U.S. region, such as this webinar today. So our website is sref.info if you'd like to learn more about us, and that's in the top right corner of this page that you're seeing right now. So the webinar today is being recorded, and it'll be archived at www.forestrywebinars.net. That's how you access the webinar to log in. And so it's going to be ready, archived in the next few days. Also, there will be instructions for receiving ISA credits, and that'll be provided at the end of the webinar. So I'll bring attention to that when we get to the last slide. Our speaker today is Dr. Kathleen Wolf from the University of Washington. Before introducing Dr. Wolf, I'll be providing a short introduction. And first, I'll talk about an overview of cooperative extension for some of you who may not be familiar with that. Then I'm going to explain how this webinar came to be. And lastly, I'll provide a brief overview of the many benefits of urban and community forestry, as we may have some participants here who this subject may be new or unfamiliar. I also wanted to announce that there is a similar webinar going on today. Let me get to this slide. So we wanted to give them a little bit of attention here. So this is with the U.S. Forest Service Urban Forest Connection Series, and the webinar is entitled The Green Heart Project, Studying the Impact of Trees and Green Space on Cardiovascular Health. And that's by speakers Ray Yeager and Chris Chandler. So highly recommend anyone going and checking out this webinar as well. It will be archived. I've provided the link here. You can also enter U.S. Forest Service Urban Forest Connections and easily find that webinar. So I wanted to provide a little bit of an overview on the cooperative extension. So for those of you who are not familiar with cooperative extension, the Smith-Lever Act, which formalized extension in 1914, established USDA's partnership with land-grant universities to apply research and provide education in agriculture. So Congress created the extension system to address rural agricultural issues. Today, however, extension has expanded its focus to match changes in society and economics, providing research-based education on gardening, family and consumer sciences, forestry, natural resources, community development, water quality, youth education, urban tree management and urban forestry, and so much more. Popular extension programs a lot of you are probably familiar with are 4-H and the Master Gardener program, and much more. Extension is a trusted information resource in communities, and for those of you who are not part of Extension, we make great partners to disseminate information like urban and community forestry to the public. So keep us in mind when you're wanting to partner on education projects. So transitioning now, I'd like to share how the webinar today came to be. So in collaboration with Southern Region Cooperative Extension Urban and Community Forestry experts, our office planned a webinar series entitled Understanding Urban and Community Forests, an Extension webinar series. The webinar today is part of this series. All of our planning partners are included on this slide, several Southern Region partners through Extension, and they were really instrumental in the development of this series. The primary target audience for the series are Extension County agents and other Extension educators. The series may also be relevant to other natural resource educators and practitioners as well, including arborists and urban foresters and more. Regardless of your work focus, of course, all are welcome to join today's webinar and any webinars in the series. So the goal of the series, which includes 12 webinars in all, is two-part. One, to provide research-based urban and community forestry information to Extension educators, and two, to provide educational resources that support the delivery of that information, both to increase Extension's and other educators' role in urban and community forestry education and outreach. So we're really hoping the series will reach not only Extension personnel focused in horticulture, urban forestry, and natural resources, but also Extension personnel involved in family and consumer science and other focus areas. So urban and community forests provide numerous benefits, which I'm sure many of you are well aware. And as you can see here, urban and community forests help clean our water and our air and even our soil. They help reduce wind speed and noise. They provide a sense of place and connection, beauty and food. They also reduce our energy bills and increase our property value. And as Dr. Wolf will explain momentarily, urban and community forests improve our health and our well-being. So, without further ado, I'd like to now introduce our speaker, Dr. Kathleen Wolf. Dr. Wolf is a research social scientist at the College of the Environment at the University of Washington and is a research associate with the USDA Forest Service Pacific Northwest Research Station on a research program about human dimensions of urban forestry and urban greening. Are you ready, Dr. Wolf?
Yes, and are the new slides visible here, Holly?
I see them. Does everyone else see them?
Great. Holly, thanks so much for the introduction and more importantly, for the invitation to present as part of this series. I really appreciate the opportunity to share not only my own research, but the research of a community of science about the importance of trees in cities, particularly from a health perspective, a human health perspective. And I hear from many people who work in urban forestry and observe that the public, generally people who live in cities and are moving around in their daily lifestyles and activities, generally don't acknowledge trees. They don't recognize them for the remarkable living things that they are and all the services that they provide us. So my effort today, as well as another webinar that will be happening, let's see, about in a short while. The second webinar will look at programs. So today I'm providing a range of the evidence, the current science with regard to trees, the urban forest, and health outcomes. But another webinar will follow that will then translate that knowledge to programs. What are some of the things that people are doing in different communities to act on and activate this research? Here's my outline, 3 basic topics, high level. First of all, health and nature, what is the evidence, with a focus on trees for this particular talk. And within that, then I will share some key studies. Finally, some of the most interesting work that's coming along is starting to address goals, metrics, the general idea of dosage. And so I'll share some of that information. Let's first think about what is health. And the World Health Organization put out this definition decades ago. And it's more than acknowledging or treating disease or infirmity. It is a more comprehensive state and set of conditions that promotes physical, mental, and social well-being. And this is a bit of a frustration that I have with our current national and local discussions about healthcare, insurance, and so on. Those are very important discussions, but they don't acknowledge the upstream influences of human health, the situations and conditions that may prevent people from having to go to the doctor or being ill, and thereby saving tremendous cost and improving quality of life. If any of you interact with public health officials, or if you are a public health official, this is a term that is being used more frequently to describe a full array of influences on public health. Social determinants. So while we often we hear about or think about health and nature as the individual choices that we make, such as should I drink bottled water, should I eat organic food, or of course any risks that might be in the environment, toxins or things that may be on the ground or in our community. But there's then the positive side of nature, and it's much broader than those immediate decisions that we make. And so those of you that work in urban forestry, community gardens, if you're a master gardener, and so on. You are a part of important social determinants in communities that can enable and promote better health. The array of this research is both, it's very broad, and some of it's just fascinating, at least to me as a social scientist. This was a study that was done just a short while ago, or published just a short while ago. And Nalini Nadkarni, who's at University of Utah, and some of her colleagues have been working on nature programs in prisons. And in this particular instance, this was a high security prison, people who are in solitary confinement. And they had as an option to infrequent and brief time outdoors, or an exercise room, was to go into what they called the Blue Room, where they could encounter these ongoing nature videos, fairly large broadcast nature videos. And they found statistically significant outcomes of, over time, these people being more calm, less irritable, and importantly within the institution, committing less violent infractions, primarily against staff, but also against the facility. All right, so that was a teaser, right? This literature is broad and deep, if you will, but not always necessarily easy to access. So here's a tool that may be helpful to you. It's a portal, a web portal called Green Cities Good Health. And my colleagues, my students primarily, grad students, with support from the Forest Service, we have collected thousands, literally thousands of articles, and summarized them in this particular website. So we've sorted the content into about a dozen themes there on your left. And if you go to any one of those themes, here's what you see on the web page. And apologies for that phone there in the back. That should end quickly. But anyway, each of the summaries has a brief introduction. Then it has a combination, or it has a presentation of fast facts. Following that then is a longer summary that provides more depth of information, and with depth of information and with full citations. All right, if we take a look at the website, it's a brief summary, a brief overview of this extensive literature. And we're now looking at over 4,000 peer-reviewed publications. Here is a representation of that collection of publications. For each of the topics, the horizontal bar represents the percentage of articles about that topic in the entire collection. So we see that, for instance, active living, this idea of being outdoors and being active and its contribution to physical health and other health outcomes, is a large representation, almost 15% of the collection. On the other hand, safe streets, the role of trees and vegetation in creating, reducing risk of accidents and crashes and so on in urban areas is less studied. And most of this has to do with available resources. Where there are grants for these sorts of studies, that's where you find the work focusing. And so Robert Wood Johnson Foundation and other organizations have been promoting better understanding of active living, hence the longer bar. Within each of the bars, take a look at the different colors, and those represent the different the different decades of work and when it was done. So early on, when I graduated in the 1990s, you could see there wasn't a lot of work and consequently not a lot of understanding about this relationship of health and nature. But then in the 2000s, it has really taken off. The last decade, for instance, the green, look at that surge of publication. And what we're talking about are English language journals, peer-reviewed articles, and these studies are from all over the world. England, Canada, the United States, Japan, Korea, more work coming out of China. And so in those gray segments, what you see just in a half decade, how this surge of activity, this surge of science and publication is continuing. There are other efforts to summarize this work and present it in accessible ways. And here is another product, Outside Our Doors. I collaborated with the Nature Conservancy, and this is available on the web if you search the Nature Conservancy and Outside Our Doors. Also, I'll be talking about various other documents, and the links to those documents are found on the information landing page that took you to this webinar, and that will remain up. That will be archived, so you can go back to those links at any time. My most recent work is an effort to convert some of the health benefits to economic terms, and we're just beginning this process. So this brochure outlines some of the preliminary ideas and findings, and that is, if someone is encountering nature and they don't need as much medications, or they don't need as much counseling, or they don't need to go to the hospital as often, we capture those costs and benefits, or could capture those costs, recovered costs, in ways that might continue to support ongoing greening in our cities. Thanks to the Forest Service, this brochure is now available in Spanish and Arabic. And again, links to these documents are found on the website, the landing page that announces this webinar and provides the link to it. If you open the brochure, what you see is sort of a story, a way of structuring all of these findings that are coming to us from around the world. Ranging in age, we're using a life course or life cycle idea, from infants to children to adults, and then to seniors or older adults. And I'll be talking about that a little bit more here as we move along. But I do want to call out my colleagues who have assisted with this work. They're economists and have really been instrumental in making this happen. Steve Grado, Mark Measles, and Dr. Alicia Robbins. Another publication you might find useful just has come out this month from the USDA Forest Service. And again, if you search this title, Urban Nature for Human Health and Well-Being, USDA Forest Service, it should come up immediately. Also available as a link from the webinar landing page. All right, I provided an overview here of some ways of accessing the research, but now let me provide some of the studies that help us tell this story. And I will be focusing on trees, though the research conveys findings about gardens, parks, being active in the environment, such as stewardship, and so on. And then I'll talk about goals and metrics. All right, I personally, with my team, we've connected nearly 5,000 publications. It's important to note that this work spans more than 40 years. Sometimes when speaking about this with people, they react with the comment, "Oh my gosh, this new research that's going on." I'll just say it's been happening for a very long time. And that reflects the depth of knowledge and the conviction that we can express about this work and its meaning in our communities. In my own work, I would say I'm in a late career sort of stage. And early on as a scientist, I was more focused on data and information, and that is conducting research, then writing it up and sharing those peer-reviewed publications and technical documents. But now as I'm older, and also as a consequence of assembling Green Cities Good Health, I'm more interested in knowledge. How do we synthesize this information? How do we translate it into products or stories that have meaning in people's lives, and thereby they might take it up and support budgets and policies that encourage more nature in our cities? All right, so here's the story that I mentioned. Life cycle. What we see across this research is that from the very earliest days of our lives to the very end of our lives, it's important to have nearby nature in our surroundings. So, starting with infants, Jeff Donovan is a colleague of mine within the Forest Service, and he did a study some time ago in Portland, Oregon, and he found that having trees and tree cover, canopy cover, near a woman's home when she was pregnant, there's across the population, across the city, there was a connection to having higher birth weights or a smaller number of children born at low birth weight. And this work it gained a lot of attention, and so other studies have been done, not necessarily replicating it because other studies have used different measures of nearby nature, parks and such, but with a remarkably consistent set of findings in that having a fairly small buffer area or distance of nature to the household seems to be correlated in statistically significant ways to birth weight. Other studies are, and this is more recent work, have addressed this idea of hygiene hypothesis. And the premise is that we have so sanitized our urban environments that people are not getting access or contact with the microflora and microfauna of nature that possibly help set up the microbiota in our own bodies that are of benefit. So we're hearing about probiotics, and there's endorsement for eating certain yogurts and certain foods and whatnot. But the research in this realm suggests that we need more fundamental contact with nature to establish that biota. And it has to do in having a healthy gut environment actually connects to our mental health and mental function, including potentially alleviating depression and boosting immune function, to the point where perhaps children need more direct contact with nature. If you look at our playgrounds in our cities, they're very sterile. Metal and plastic structures set over mulch or rock or even rubber surfaces. Not much contact with more ecological or ecosystem nature, which may be valuable for setting up a young person's immune system. John Gathright is an arborist, started out as a consulting arborist, and now does recreational tree climbing and therapy tree climbing in Japan. And his work, he's done a few research studies about this, finding some remarkable results and value for people from a therapy perspective. His website is just so much fun to visit, and he's actually visiting North America. He'll be speaking at a conference in Vancouver, an international urban forestry conference in the autumn. But he started out by working with a group of, this is a membership group, and it's therapeutic support for children who have minor birth defects. If you look at that little image on the bottom right, you see these kids, some deformity then of their extremities, toes and fingers. And they're fully functional people, and they're clever and bright and fun-loving, just like any other children. But because of these minor birth defects, they have been shunned, bullied perhaps in school and in their communities. So the tree climbing group is an effort to help them meet other kids, to build confidence. So these kids learn about tree climbing. It's not just show up on a Saturday and climb up and down a tree, but they learn about the technical aspects of this. They spend significant amounts of time in the trees, sometimes even camping, and just building a solidarity and self-esteem and mutual support. And I have visited one of these events. They just have too much fun, really. So I'm learning and seeing that there are more recreational and therapeutic tree climbing events here in the United States. So it's something that you might consider, is teaming up with your local chapter of ISA, International Society of Arboriculture, and perhaps offering these sorts of opportunities. Okay, continuing with the science. These studies about trees and health, they've been done at different scales. Some of them are encounters with street trees or your personal landscape, your private property, or in this case, it's about tree canopy. And I was a part of this research team, and what we did was to compare LIDAR, which is a remote sensing, very high resolution remote sensing data about vegetation in the city with CHIS data. CHIS is the California Health Inventory Survey. And this survey is done on a randomized basis across the entire state of California, and it has been done for some time, so there's a nice longitudinal database. So what we did was to compare LIDAR and CHIS data for the county of the Sacramento County in California, and we found that with more tree cover, there was a better overall health response. And importantly, related to that was better social cohesion. And that's important because the medical community and public health community is recognizing, again, because other research work, that being socially connected to loved ones, to people in your community, to organizations is actually one of those social determinants of better health. Here's another study done by Jeff Donovan and his team. And what they did, emerald ash borer is a bug that has ravaged ash tree populations in cities across the country. It started out in the Midwest and the East and is now moving west. It has gone as far as Colorado, and we're hoping it won't proceed much faster to us here in Washington, Oregon, states, California, and so on. The reason it has devastated these forests is there have been various planting programs, and at some point in time there was an emphasis on planting ash trees. So what you see in some communities, some counties, is where these beautiful tree-lined streets, then fairly quickly after the bug has arrived, is diseased trees that die, and we can't leave those standing, so municipalities are removing these trees fairly quickly to prevent hazards of them falling on trees and, cars and people and residences. The next image, if we would see it, would be this barren neighborhood with no trees or nearly no vegetation, large vegetation. All right, so Jeff and his team, what they did was they captured public health data and tree removal data in a number of these communities, and they did a pre-post. It was sort of a natural experiment. And here's what they found is after the trees are removed, more deaths from cardiovascular disease, more deaths from respiratory disease. And you might be thinking, yeah, but there could be all sorts of other factors. In doing this work, they do regression modeling and control for the other circumstances as best they can, the other circumstances and conditions that might influence this disease incidence. Here's another study. Holly, at the outset of the webinar, talked about Urban Forest Connections, which is a webinar series hosted by the Forest Service, particularly the Urban and Community Forestry Program. And it was just a coincidence that these two webinars were scheduled for the same day and time block. It's unfortunate, but I really want to call out this webinar because it's an interesting study that is now underway in Louisville, Kentucky, where it's a longitudinal study, and they are studying the influence of tree planting programs in the community. And the medical school, a local university medical school, is involved in doing cardiovascular and other health outcomes. And so I think you'd find it quite interesting. It's a specific study, but it's really remarkable in that a direct intervention of urban forestry is now underway and will be studied. There are mental health consequences as well, and a number of studies are addressing this. Here is one sample. Mark Berman is at the University of Chicago, in this study, he and his colleagues tested for tree and nature experiences and mental health. So what they did was to recruit people who are diagnosed with major depression. This was an experimental approach. And so the adults were randomly assigned to two different conditions. One is the red walk there that you see is through a more built environment. The green walk is through a more vegetated urban condition. And this was done in Ann Arbor. That the green walk was actually through an arboretum. And I did my graduate studies in Ann Arbor. And I tell you, I spent a lot of time in that arboretum for exactly this purpose, stress reduction and getting away from the demands of graduate work. But to this study, people then were tested for affect or emotion and also for cognitive performance. And in both instances, there were improvements following the green walk. Again, in an experimental condition or situation, after I believe it was 2 weeks' time, the test participants came back and they were reassigned to the opposite condition. In this way, controlling perhaps for other situations or other conditions that might have contributed to the outcome, more personal factors. Forest bathing, Shinrin-yoku. This type of forest experience and the health benefits that it provides has been studied for over a decade in Japan, somewhat in Korea as well, and with some of the most robust, rigorous science that has been applied to these sorts of studies. And what they have found then is stress reduction, better immune function, reduced diabetes symptoms, reduced hypertension, and so on. And if you search for forest bathing or Shinrin-yoku, you will find access to these studies as well as a number of reports that combine or consolidate this information. The research is so compelling that there is now a network system of forest bathing places in Japan, many of them located next to major cities, where urban residents can then find this experience and enjoy its benefits. It entails several hours of walking in forests or woodlands, maybe a day, maybe a weekend, but all with remarkable benefit. And so what I've done is you've seen I've walked through from cradle to grave, from infant to children to adults. And here's the one example from older age. There are others, of course. But we're seeing the public health community is noticing a rise or an elevation in the extent of cognitive disorders or dementia in older people. And it's not just because of the boomer or the age, the demographic where there are more older people. It's that there's a greater proportion of older people showing dementia disorders. So here was a study that was done in a facility, a care facility, where they had wander gardens. And these are gardens where people are able to go outdoors and wander within a confined space, within a defined space where the staff is still able to look out and observe them and make sure they're okay. And with this opportunity, they found that these patients there was a reduction in medications and there was a reduction in falls, both of these having serious consequences for older people. Why fewer medications? Well, what they found is what is seen in these facilities is people are frustrated and they're agitated, maybe because of a realization of their failing capacities or just not able to comprehend what is happening to them. So the treatment often for this sort of agitation is sedatives, calm them down with pharmaceuticals. But it appears that being able to go out and walk and be in nature reduces those sorts of medical needs. Also with fewer falls, people then do not have the complications that occur when there are severe falls, broken hips and immobility and so on. All right, I've given you a very quick overview, a sampling of these studies that represent 40 years, decades of research, thousands of articles. Now I'm going to close with sharing some of the most interesting findings with regard to dosage. So a lot of the studies that I've shared with you, that what they express is, here's a nature condition, be it trees or canopy or parks or gardens, and here's a health outcome, be it physical activity, cardiovascular disease, mental health, and so on. And there are often correlations or associations. There are statistical connections, but we don't understand why necessarily. And we don't understand how often, how much, what is the nature that we need in our everyday environment. So some of the most current work is recognize this dosage question and starting to set up what are some goals and metrics that we might incorporate into urban greening policy and programs. Okay, so let me start. And I'll acknowledge that these are the studies, these are the slides that are most text intensive, and my apologies. They really lend themselves to infographics, which I have not yet developed. So if anybody out there would like to team up with me to develop some infographics on these things, that would be great. All right, so general relationship that we see in public health is people who have more income they generally have more access to health care, and they generally have better health. And this now speaks to equity and disparities in distribution of green in our communities. I'm not going to say any more about that on this webinar, but in the follow-up webinar, where I will be speaking more about programs and sort of local interpretation of this science in terms of getting out and helping people, I will be speaking more about equity and environmental justice in terms of nature distribution. All right, so here's the relationship. Income, better health care, better health, and green is related to all that. So here's a study that was done in Toronto, and what they found was that with an increment of more trees within the neighborhood at the city block level, they found a correlation of decreased cardiometabolic conditions, cardiovascular disease. And they found that this corresponded to, or is not associated to, but corresponds to increased annual income or increased median income within a neighborhood. So we're starting to see that economic value and prescribed amount of trees in a neighborhood and its relationship to health. Here's another one. This was done by Dr. Zhang while he was a student at the University of Illinois, and he worked with Bill Sullivan. You may recognize that name. Bill Sullivan and his colleague Ming Kuo, or Francis Kuo, did a good bit of work decades ago in public housing in Chicago, finding an array of interesting outcomes. But in this particular study, it was experimental, it was laboratory, and what they did is they displayed images to the study participants that showed a range of percent canopy cover from 0 to 60%, and that's the red line that you see here, tree cover density. Then what they did was to measure stress recovery. People were, they were given a stressor, and I must say I don't remember what that was, but it elevated people's stress response. And so they go into the situation where they're seeing differing images of canopy cover. And there you see, it's not as linear as the red line, but you do see a pattern of improvement of stress response, reduced stress, measured by physiological measures as well as self-report measures, that corresponds to the amount of tree cover. What's interesting to note here is that the scientists noted a threshold of about 40% canopy cover where the stress reduction plateaued, or you didn't see as significant gain. So maybe that's something that helps us to validate or to quantify canopy cover recommendations in our cities. For those of you in urban forestry, you're aware many cities that have urban forestry programs have established canopy cover goals. And some of them are citywide, some of them differ by different land uses within a community. But most of those canopy cover goals are set based on environmental services such as water quality, air quality, carbon, and so on. But here is a public health validation of canopy cover achievement or goals. And I think this is a really interesting connection between environmental services, which you'll probably hear much more about in some of the other webinars in this series, and health outcomes. All right, here's another dose response, if you will, study. And they studied a range of circumstances, community level circumstances and mental health outcomes. And so I'm focusing on the finding with regard to vegetation cover, though they also found some positive responses with afternoon bird abundance, suggesting that vegetation is but one element of this. Wildlife, of course, although I am not aware of the range of studies about wildlife, but also sounds. There are more and more studies coming out about soundscapes and health. Anyway, here we are. What we see is depression, anxiety, and stress, mental health. And what they found was that depression is reduced when you have more than 20% cover of vegetation in a community, within a buffer area, within the proximity of a person's home. They found reduced anxiety after 30% vegetation cover. And they found reduced stress after more than 20% vegetation cover. So here again, we have some possible metrics to apply to policy and programs in our communities that relate to the presence of vegetation and health outcomes. And here's the last one that I'll share with you. And this was a study done in Canada. They had access to a national behavior and school-age children survey. And they looked at the proportion of neighborhood land covered by trees, all right? And they related that to physical activity, reported physical activity in households. And then they found that there was a relationship that with 5% increase in cover, tree cover, they found a 5% increase in the probability that children would be more physically active in their free time activities. So here again, we're promoting better health in children. It's so important because if children have better health in their younger age, they're less inclined to certain diseases and certain illnesses as they age, even right up into middle age, 40s, 50s, 60s, and so on. So again, maybe we can better understand how to strategically place urban greening around households where there are more children or neighborhoods where there are more children in order to encourage more physical activity. All right, I'm winding up here. Here's a summary. A lot of content. I presented a lot of content fairly quickly, but again, I'm only scratching the surface of this body of research that has spanned many years, many countries, and many different investigators. And I feel we have enough to speak with conviction about the importance of the gardens, parks, and trees in our cities. It's more than pretty. It's more than beautification. It's essential. It's a social determinant of public health. And it leads us now to talk about programming, about how we instill this evidence into the facilities and programs and fun stuff that people can do in their communities. And that's what I'll talk about in this follow-up webinar that'll come along in a short while. And in this way, we can integrate urban forestry, trees, and urban nature more broadly into our urban systems, the things that people care about as they do their work in communities. All right, let me leave you with a thought, a personal interpretation of all of this. This weekend, I am going to visit my daughter in Alaska. She lives in Juneau, and she is a wilderness guide, at least in the summer. She does environmental ed in the winters with school children. Whenever I visit her, I never know what's going to happen because she always has these incredible outdoor experiences, peak experiences. I have been taken into ice caves within glaciers. I have gone kayak camping near glaciers. She does grizzly bear tours in a bear reserve on Admiralty Island, and I once was able to go with her. And she promises that she's actually almost forcing me to take up rock climbing so we can go into some unusual and fantastic places. What I'm getting at here is these are peak nature experiences, and they happen beyond the city. But this research that I've shared with you suggests that we need nearby nature on a daily basis. We need it outside our schools, outside our offices, outside our homes, in our personal gardens, but more importantly, we need it in our public spaces all through the city. And so to me, this is equivalent to nutrition. So we need daily sustenance. We need quality food on an everyday basis to get the basic nutrients, to get hydration, to get what we need to be at our best. But every once in a while, we go out and we have a feast, Thanksgiving, or a nice dinner out with a group of friends or family. So nature serves multiple roles and multiple experiences. It can be a peak experience, but we also need that everyday encounter and that everyday sustenance. And so that everyday nature is expressed in many ways in our communities. It might be urban forest canopy, parks and gardens. It might be green stormwater infrastructure, where we look at design for that infrastructure, not only to manage water, but to provide microparks for people. And finally, there's biophilic design. It's an idea that landscape architects and other designers are taking up to instill or to integrate nature right into the very built environments that they create. So here's the end of my presentation. This is sort of my digital CV, if you will, other studies that I've done over time about nature in retail environments, the role of trees and transportation safety, as well as some of the translation of this work to policy and planning. And with that now, I'm going to turn this back to Holly as we move to question and answer for the last minutes here of the webinar. And I note that a number of you have been typing in questions, so we'll try to get to as many of those as possible. So Holly, I'm going to turn over the screen back to you.
Okay. All right, can everyone see this last slide? Dr. Wolf, that was an outstanding overview, and you sound like you've also had a very exciting life. If you need someone to carry your backpack in one of those ice caves again, I have someone in mind named Holly Campbell, so just let me know. Okay, so as people are typing questions in the Q&A, I would like to call your attention to this last slide. And it includes some information that Dr. Wolf has gone over in her presentation, and a few reminders. So again, definitely type your questions in the Q&A. Okay, so again, there's a part 2 to this webinar. We wanted, Dr. Wolf talked about first presenting the research today, and then on March 28th, she is going to share educational programs that are currently underway and resources that educators or anyone can use in teaching people about this information. So that webinar is also going to be found on forestrywebinars.net. It's on March 28th, same time, 1 p.m. Eastern Time. So we'd love for you to join that. And that webinar is called From Science to Action, Evidence-Based Programs for Nature and Health Communities. So If you have any questions about this webinar or any in the series, you can contact me at hollycam@uga.edu. And if you are interested to access the entire webinar series, you can link to it on the webinar portal, which is provided the description of the webinar and the link of how you joined this webinar. If you scroll down to the bottom of that description page, you'll see a link to the entire series, which includes 12 webinars. So we would love if you would want to join any of those webinars. They cover a range of topics in urban and community forestry. And all of the webinars are going to be archived on forestrywebinars.net. So today's webinar is going to be archived. If you wanted to recommend it to anyone, or if you want to listen to it again, it's going to take me a couple of days to get it up online, but it will be available in a few days, and also ISA credits will still be available at that time. And as far as accessing ISA CEUs, you can go back to you can read here at the bottom. You can go back to the Zoom link, the webinar portal page that you opened, which will still be open on your browser, and that's how you can access your ISA. There's a link there that will provide the information that you need. If you have any questions about that, please just contact me, hollycam@uga.edu. And also, we ask that you join in a short satisfaction survey following the webinar to help us improve our webinars for future reference. Okay, so let's go through some of these questions. All right, so this is one I could have answered to who asked me this, but I wanted everyone to know. So the first question is, will the resources mentioned earlier be made available via web link? Yes, if you go back to the webinar portal, all of the resources that Kathy referenced that are online will be available on that description page. If you are interested in more than is listed there, the hyperlinks that are listed there on the portal, just contact me and I will contact Dr. Wolf and obtain those for you. Okay, so next question for Dr. Wolf. It says, I think it says this info, and I'm trying to think back to what info we were referring to. It says, has this info been shared with the Arbor Day Association? Being a longtime member, I'd like to see them with this too, maybe participate too. And I think that this was referencing general information about health and well-being related to urban greening and urban forests. I don't know if you want to add anything to that, Dr. Wolf.
Yeah, I'll speak more broadly. So the Arbor Day Foundation is, I would say, well aware of the on a concept level, or they're aware in a general level of the health and trees and nature relationship, though they may not know a lot about the specifics of the particular studies. I would say that many of the organizations that support either professional or policy or management of urban nature, including trees, are either very aware of this research or becoming more so. The phase that I see where we're at is this translation. Okay, we have the facts, we have the evidence, and it's starting to be acknowledged by the medical and public health community. Because of the quality of the science, I find that many organizations are now trying to figure out how to translate it to the programs and the resources that they offer to their communities and to their membership. So I think that's what we'll see coming along in the next few years, is really some remarkable implementation of this work in ways that can make a difference in people's lives. Again, and all of this recognizes that, I still encounter, oh, aren't trees pretty? And, oh yeah, I'm a member of the beautification committee in my community. It's so much more than aesthetics now. Aesthetics are important, that pleasing visual quality. But some of these studies, many of these studies actually, they're reporting on outcomes of people who do not even know they're being studied. because of the access to health records at the county level or maybe even the hospital record. So they're not self-reporting. These are not people that are self-selecting who enjoy nature. These are effects that are seen across broader populations and in the scientific ways that are the scientific processes that are acknowledged by the health community of being double blind and randomized and such. To go back to the question of awareness of this work by the Arbor Day Foundation, I would say yes, as well as other organizations, and many are attempting to translate it into some sort of program.
Great. So I'm going to skip around on these questions here, but we had one that was referencing a slide that you had showing that people who lived in neighborhoods with more trees had lower cardiovascular health problems and tended to have higher income, if I'm remembering that correctly. So the question is, does this just mean that certain people can afford and choose to live in areas with more tree cover? How does the research take that into account?
I think I know the slide you're referencing, and unfortunately, in having only an hour to convey decades of research, I may have talked through things a little too quickly. So let me back up into that a little bit. All right, stand back a little bit from nature and health and just health relationships in general. Generally, people who have a little more income have greater access to health care and do have a little better health. So some people are now promoting nature as an intervention in some of those communities that are not as affluent, as not a compensation for income, but a way to introduce a better social determinant into those communities. That said, now let's turn to the study itself. These studies, what you're asking is, might there just be a relationship between people who are more affluent living in places that have more trees, and so they're revealing these better outcomes, cardiovascular disease, respiratory. These studies, many of them are very sophisticated models using various types of multiple regression. And multiple regression allows one, so there's the outcome variable of health, and then there's an influence variable of nature in whatever way it's measured. But one can input into that model other characteristics or traits, be it personal or community level, that may influence that relationship between those two main variables, the nature and the health. In that way, you can isolate the effect of nature on that outcome. And in that way, in another way of saying that, you can control for income, you can control for age, you can control for education, you can control for locale. And so these relationships of nature experience and better health also hold for lower income communities and individuals. What that suggests is that the disparity or in distribution of these resources is important. And again, I'll get into that in a little more detail in the next webinar. It's a complex relationship, and it was something that I really couldn't delve into during my intention to share the broader sort of realm of this research. But it's important, and I will spend more time on that in the next webinar. Thanks for the question.
Great. We only have 1 minute left for this webinar, and so how we're going to handle the rest of these questions is we'll just, Dr. Wolf will answer them. There aren't many of them, Dr. Wolf. We'll answer them via email, and we'll just reply all back to all of you so you can see the list of questions that had yet to be answered. Would you like to answer one more before we end the webinar?
Yeah, that would be fine.
Okay. Have you found that this great research is being taught, given to hospitals, medical schools, etc., so it can be used for health, quote-unquote, prescriptions, etc.?
Really good question. And I have to say, I don't know. I know that there are practicing doctors that are starting to implement this in their practices. And not only in a casual way, and that, recommending that a patient go out and take walks and be in nature, but there's one doctor in Washington, D.C., Dr. Czar, who is actually putting these recommendations or prescriptions, PARC prescriptions, into his patients' records. And I think this practice is being, there's an uptake on this with other medical professionals and systems. Has it reached the teaching and training system of doctors? I really can't say. Very good question. I might dig in and see if I might, I have some colleagues who might be able to answer that question, so maybe I can circle back on that.
Great. Thanks so much, Dr. Wolf, for giving this outstanding webinar to all of us. I learned a lot in the process as well. And also thanks to everyone who joined the webinar. We would love if you could join us part 2 of this webinar, which is on Wednesday, March 28th at 1 p.m. Eastern Time. You're going to log in the same way. It's a webinar, Forster Webinars. Am I saying that wrong? ForsterWebinars.net. Yes, and the webinar is called From Science to Action, Evidence-Based Programs for Nature and Health Communities. So thanks again. If there's nothing else you wanted to share, Dr. Wolf, I think we'll go ahead and end the webinar now.
I think that's it. Thank you for all who attended. Perhaps you'll listen in again. And please, Green Cities Good Health, I'll say there are now ever more resources for accessing this information, this science. Green Cities Good Health is one. I noticed that Naomi Sachs with the, I have to make sure I'm saying this correctly, but therapeutic landscapes. So there's another dimension of that, and that is the introduction of nature into therapeutic situations, including hospitals. Naomi Sachs is a leader in that regard. So there you are. Thanks again, and take care of yourselves and walk in nature when you can.
Thanks, Dr. Wolf.